Hello, everyone. Thank you so much for being here today. Welcome. My name is Krystal, and I am with Borislow Insurance's Health and Wellbeing team. And today we will be hosting a webinar on heart health awareness. So thank you so much for being here. We really hope you enjoy it. As a short disclaimer, I am not a doctor, and this is not actual medical advice. So if you have any concerns, please reach out to your primary care physician or your doctor. This is for educational awareness purposes and engagement purposes only. So we hope you enjoy it. Thank you so much for being here today. A little bit about who we are and what we do. We offer support regarding health and well-being through culture audits and strategic planning. We offer alternative wellness solutions. We have live webinars such as today's or on-site classes. We assist with health fairs and on-site demonstrations. And our biggest focus is on coaching and behavior modification solutions. So we have educational content, engaging challenges, and you'll see a little bit of that throughout the presentation. I love an engagement presentation, so you will see some polls in today's webinar. And so please feel free to engage. I know personally, I like webinars that strive towards action rather than just hearing the education and kind of putting it aside and forgetting it. So you will see that throughout today's presentation. We will review what an unhealthy heart is, the various symptoms, the causes, and then we will finally reach a healthy heart lifestyle. And so please feel free to stay to the end. We have quite a few things that we can do in our day-to-day that can help take care of our hearts, and you're important, so I hope you enjoy them. Just to start off today's webinar with a fact, heart disease is the #1 silent killer and cause of death. And the reason I share that is just to bring awareness as to why we're talking about it today. February is Heart Health Awareness Month, and so we will be focusing here. It's not to scare you, because the good thing is it is a preventable disease, and it's even reversible. And so that's why the lifestyle section in the webinar is extremely important. So not to scare you again, because it is reversible, it is preventable, there are things we can do. But it is a big focus because it is our #1 silent killer and cause of death. So again, I like engagement, so I will just start with the polls and test your knowledge. So let me launch this first poll. Is heart failure and a heart attack the same thing? So I'll give you a few moments to choose yes or no. Again, no pressure. This is just for fun. Do you believe that heart failure and a heart attack are the same exact thing? We'll go ahead and close the poll and share the results. And correct, most of you guessed no. Great job, absolutely. They are not the same thing. So let me share. An unhealthy heart and heart failure and heart attack are not the same thing. So heart failure is actually the weakening of your heart muscle, resulting in being unable to pump the necessary blood and other organs into your body. A heart attack is when the blood flow stops instantly, fast. So the muscle begins to die immediately. So the heart failure is a slow weakening of the heart, where a heart attack is instant. And often heart failure leads to heart attack. So the way that both of those occur happen through clogged arteries, which are the major blood vessels in which carry blood, oxygen, and nutrients to your heart. As you can see in the picture, this is what an unhealthy artery looks like. And we'll go over cholesterol and the space that cholesterol plays a role in. So what are the symptoms of an unhealthy heart? They are fatigue, shortness of breath, chest pain, dizziness or nausea, and heart palpitations. Again, these can be significant signs but they can also be hard to notice because often in our day-to-day, we might feel tired or we might be short on breath from walking up the stairs or something like that or whatnot. So just a few things to keep in mind and just to be ready is where's your closest emergency room? Remembering to dial 911 because again, we talked about a heart attack being fast. So having a phone close by can be helpful in those instances. And then also an AED or an automated external defibrillator, which it accesses and analyzes the heart rhythms. So if someone is struggling, an AED is typically close to an entrance or an exit space. And so when it analyzes the heart rhythms, it actually provides an electrical shock to the heart to help stabilize that rhythm and take care of somebody who might be struggling in an emergency situation. Again, testing your knowledge. So what causes an unhealthy heart? So I will just bring up the next poll. Do you believe that it is clogged arteries or plaque buildup? So I'll give you a few moments to participate. We've talked a little bit about clogged arteries already, and we will talk about plaque as well. But which one do you believe causes an unhealthy heart? Give just a few moments, and then I will stop the poll there and share the results. And that is correct. Plaque buildup is the leading cause towards an unhealthy heart. So it typically begins in childhood actually and worsens over time. So most commonly caused by plaque buildup in the arteries through the body. So high blood pressure, smoking, stress, obesity, diabetes, lack of physical movement or exercise all contribute to plaque buildup in your heart. As plaque builds up in arteries, the arteries begin to narrow, resulting in hypertension or sometimes known as high blood pressure. If that plaque closes off the arteries, then blood, oxygen, the nutrients, they're all unable to be distributed throughout the body, which results in cardiac arrest. If plaque ruptures into the bloodstream, so it's closed off completely and ruptures, then your platelets are activated and they try to begin to control the damage and begin clotting. When that happens, it leads to blockages and that causes heart attacks and possible sudden death. So that's kind of the progression of why plaque buildup is harmful to your heart and the different stages that it could take. So what causes plaque buildup? Cholesterol is the leading cause for plaque buildup and primarily through our foods. So it is made in our liver at 80% of that focus. So that is formed from fatty, acidic foods such as fried food or fast food. And I just kind of wanted to demonstrate on this slide here that all foods contain cholesterol because our body converts them. But there are different versions or different healthier versions of foods that you can utilize to decrease the cholesterol and decrease the plaque buildup. So fried and fast food are the least healthiest, followed by animal foods because they themselves create cholesterol as well. And that includes eggs, shellfish, meat, dairy products, although they are healthier than your fried or fast food. And then we finish with plant foods, and they have a cholesterol substance in them as well, but it is so low, it's actually in a single-digit percentage. So it is your healthier version. It is everything that you probably already know already, but just a reminder that in your day-to-day lifestyle, the various foods that you choose can either contribute or reverse your cholesterol. So we'll test your knowledge again, because this is a common question that comes up. Do you believe that heart disease is hereditary? Do you believe that yes, it is, no, or yes and no? So I'll give it a few minutes so that you can answer. Again, this is just something fun. Our doctors often ask us about our family history, so I wanted to bring this into the presentation today. I'll go ahead and finish the poll and end there and share the results. So great job. The answer is yes and no. So genetics actually play a lesser role in heart disease than you may think. They actually only account for about 3% of your likelihood of, of the disease itself. So only 3%. It's actually pretty low than what I would have thought originally. The primary link is actually between your family members and yourself of the disease actually falls in your day-to-day habits. You probably have very similar habits and you probably eat very similar foods across the board. So that's why it looks as if the disease is hereditary. And that's why we also point out that it is preventable and it is reversible due to what you eat and due to your habits. So if they change, then you have a 97% difference that you have to work with rather than being stuck in that 3%. So just a quick check-in, just to see where everybody is. I'll pull up this slide. Do you struggle with any of these causes? Yes or no? Again, no judgment. This is just to see where everybody falls. High blood pressure, smoking, stress, obesity, diabetes, lack of movement or exercise. Do any of these kind of stand out that you might personally struggle with? Again, no specifics. Nobody's going to be shamed at all. It's not the purpose of this poll, but just to see, that you may or may not be alone, and see that we're all human in this too. So I'll go ahead and close the poll and share the results. So yes, some people do great and they actually don't struggle with any of these causes. So great job. That's amazing. It's lifestyles can be tough to implement. And so great job there. But you can see that the majority do struggle with maybe one or more of these causes. So just know, again, the purpose of this just was to say, you're not alone. We're all human. We all have stuff that we continuously work on. And so I just wanted to kind of finish out that section of what an unhealthy heart is and that you might be struggling with something before we move into the lifestyle space. So like we said, the 80% of the heart disease is found in our lifestyle choices. And that's what makes it preventable and reversible. And so it's a great time to take care of your heart. So I wanted to share a few things as we move forward with the remaining part of today's webinar. And so you will see, I'll go through a few examples, but it's kind of separated into your score, your practice, and then the bad habits that we may have. So hang on till the end, and hopefully these help bring some awareness into lifestyle changes that you can make to help prevent and reverse your own heart health. So we'll start with your score. So knowing your numbers is where we will focus first. And you will see at the bottom of these slides that I encourage micro challenges and how to implement them through action. Again, I don't like just feeding information educationally. I'd like you to actively engage. This is your health and you're the one who can invest in your own well-being. So I encourage you to do so. Knowing your numbers, I encourage an annual checkup with your primary care physician, or at least just checking when the last time you went was. I know I can be guilty. The pandemic hit and I haven't been in a minute. So I think it's been time for me to schedule my own personal, but again, just knowing your numbers and knowing kind of where you score so you have a foundation to start with. So the first number we're going to talk about today is blood pressure. Healthy blood pressure, by having a healthy blood pressure, it reduces the strain on your heart, your arteries, and your kidneys, actually. With high blood pressure, it increases that force or that strain of blood through your arteries and actually can damage your artery walls. So with a healthy one, you'll also protect your artery walls. A normal number is 120 over 80. Again, this is an educational presentation. If you have any questions, your actual number should be talked to your doctor with, as everybody's picture looks a little bit different, but a typical normal healthy blood pressure is 120 over 80. And sometimes it can be confusing, but the top number is the pressure in your arteries when your heart beats. And the bottom number is the pressure in your arteries when your heart is resting. And so that's the difference between the two. Just to point out, sometimes I personally was guilty of thinking that, oh, a high number is good. That means my heart is pumping and it's going, and absolutely it is. But if we, like, for example, I might sit at a desk for 8 hours a day and I'm not moving a lot, that can also contribute to a higher top number. And so that isn't always a good thing. So I just wanted to point that out, that movement is good because it increases your heart rate. And then the space of rest and relaxation helps bring it back down. So you can actually lower it through physical movement, your overall general score. The next number we are going to talk about is cholesterol. So as you saw, cholesterol causes plaque, causes blockages, and harms the arteries. And so it contributes to clogging your arteries. So clear arteries are obviously the best and help your heart function with ease without putting all the extra strain on your arteries and your heart muscle itself. So we're going to talk about good cholesterol and bad cholesterol because there's two, and you will talk about them with your doctor when you check your numbers. So HDL is the good cholesterol and LDL is the bad cholesterol. So HDL, or the good cholesterol, keeps the bad cholesterol from sticking to your artery walls. It helps by the body remove any excess cholesterol because it's your body's natural creation of cholesterol, and it actually can self-destruct. So again, your body's a well-designed machine, and it has been created and has the ability to do all of these things. So it can create cholesterol, and it can also remove excess by self-destruction. Although I do want to point out the bad cholesterol, because that is created by or from our intake of food. So in our day-to-day, if we constantly take in bad cholesterol from fried food, fast food, animal products on a regular basis, then it will help contribute to cholesterol. And so your body has to work extra hard to try to remove all that extra cholesterol that you have now taken in through food and nutrition. So just to point out, there is good and there is bad. Your good is your natural, your body's ability, and then the bad is through food. So just kind of bringing awareness to maybe what you intake throughout the day. And then our last number of checking our score is through blood sugar. So food is naturally turned into blood sugar in our bodies, and we utilize that for energy. If we develop high blood sugar, then it actually damages blood vessels and the nerves that help control our hearts. Over time, if we continue to have high levels of blood sugar, then it ends up damaging our hearts and our kidneys, eyes, and nerves. So just taking a look at what those numbers might look like, I encourage you to visit your primary care physician. If you don't have one, please reach out to somebody. We can absolutely help you find one. And just kind of find what your baseline is and start foundationally of where maybe you might want to work on some things. The next few are going to be about daily practices. And so physical activity, we kind of talked about it a little bit already. Exercise is important, physical movement. So 150 minutes of moderate exercise or 75 minutes of vigorous exercise, or of course, a combination of both should be taken throughout the week. That's about 30 minutes a day or so, which can be overwhelming sometimes, especially when we're busy. We pride ourselves on being busy, but it is important to take care of your body and your system so that you're able to do the other tasks that fill your day. Um, I did want to point out that kids should get about an hour each day. And that is because, like we talked about before, an unhealthy heart starts as early as childhood. And so making sure that kids have movement too. Now is a great time. Spring is coming, warmer weather is coming. So it's great to kind of get off the couch and get outside and enjoy some movement, which is why you will see in my micro challenge, what exercise did you like as a kid? When exercise is fun, it doesn't feel as much of a task as sometimes we can make it out to be or add to our checklist. And so, for example, I sit at a desk 8 hours a day. I'm sure many others do. And so yesterday after work, we ended up going sliding. And I'm not sure about you, but the last time I went sliding, I forgot how much of a workout it is. So although it was very fun, it does take some effort to walk up the hill in all of your snow gear, and it gets your heart muscle pumping, which is great. So it improves your heart muscle's ability to pull oxygen out of the blood and reduces the need for the heart to pump more blood into your muscles, because it's really utilizing the oxygen and the nutrition that it provides naturally. So um, as we know, it also reduces stress, which is very important because reducing stress also slows down your heart rate and lowers your blood pressure. So your heart doesn't have to work as hard. So lots of benefits to physical activity, but these are how it will help your heart and help your kids and help the heart, unhealthy heart habits that we may have from childhood and onward. So feel free to share your exercise that you enjoyed as a kid, that didn't feel like exercise then, in the chat. I'd love to just check them out. It's fun and engaging. So next, we talked about this a lot. Nutrition. It's absolutely one of the best defenses against cardiovascular disease there is. You can literally dramatically lower your cholesterol and your blood pressure just by simply changing what you eat. Now, again, this is very easy to say and hard to do sometimes, especially when we are conditioned to eat typical things from childhood and growing up with families or friends or whatnot. But it can have a very big impact. So I will mention plant-based focus because, as we learned, plants have the lowest cholesterol in their foods, and then reducing animal products. I'm human. I eat animal products personally. Everybody has their own individual choice, but as we know, animals produce cholesterol themselves, and so then we have that byproduct and contribute to our own plaque buildup. So just reducing them and being kind to yourself. So utilizing the grocery stores, I feel like they are stepping up into having more options for us. So I encourage you to maybe go to a new grocery store and just kind of take a look around. It might increase your awareness, as you may not know where things are automatically. I know we are creatures of habit. And so if you want to maybe see if there's a plant-based focus on a meal that you really like, and just try it, see how it tastes. If it's great, awesome. If it's not, try something else. Every little action makes a big difference. And you may not notice it right away because it's not something we can actually see, but your heart will notice. And so, yeah, so I encourage you to try that. A personal recommendation, as you will see in the micro challenge, it's inevitable for us to sit down occasionally and you might turn the TV on. So this was personally recommended to me from my doctor. As food is medicine, so you either spend your money on food now that takes care of your body, or you spend it on medication later on with the doctor and the pharmacy. So if you haven't seen it already, I encourage you to watch Forks Over Knives. It's a great documentary, and it just talks about literally seeing the difference in your numbers by simply changing your food intake and what it does to your body internally, where you may not see it. So, and it's over a short period of time. It's not years. And so I encourage you to just take a look. I hope you enjoy it. I certainly found it eye-opening myself and increased my awareness on a daily basis. So weight. So weight management, absolutely. The more weight we have, the more work our heart has to do, and the more mass we have to accommodate. And so by reducing our weight, we reduce the strain on our heart, blood vessels, arteries, lungs, and skeleton. So losing those extra few pounds really reduces that strain, and it actually reduces the blood pressure and blood volume that your heart has to push throughout your body, which helps your heart work with ease and utilize the energy that it has. So again, this is not to shame, this is just to bring awareness. So a micro challenge is just to calculate what 5% of your weight is currently. And it's a great starting goal for weight loss. And if you don't have to worry about weight loss, great, please disregard. But if you know somebody, that a loved one, then this might be beneficial to share with them when you're in conversation or trying to support them. That 5% is a realistic goal, and sometimes we can shoot for unrealistic goals and set ourselves up for failure. So just a thought there, in trying to help with weight management, small steps at a time. And lastly, the last thing we're going to talk about, so we've checked our numbers, we know what our score is, and then we have some daily practices to incorporate everything of which you already know, and then we will leave with toxins. So obviously, the more toxins we take in, we have foreign substances that our body is naturally trying to get out. And so that's extra work that our body doesn't need, if we can. Absolutely. These toxins come with addictions and struggles of their own. So if you need any assistance, please reach out to us. We have tobacco cessation options. We can help with that. Stay tuned for next month's alcohol awareness webinar, and absolutely utilize it for yourself or loved ones. It's very beneficial because we know that this is a struggle on a day-to-day basis for some. So absolutely, alcohol and tobacco are what we are going to focus on trying to remove or at least decrease, because they both increase your blood pressure and your blood sugar. And so I just wanted to point out that if tobacco specifically, if someone quits for 1 year, then it actually cuts their risk of heart disease by half in just 1 year, by half. So again, every little bit counts, every little step counts, and that could have a big effect. So cutting it in half is huge. So again, not to shame, just a micro challenge. How many times do you personally use tobacco or consume alcohol in a day or a week? And this is just to increase your awareness. This is just something that, again, if not relevant for you, could be for a loved one or a coworker or something like that. Just to bring awareness of, maybe I do have, too much of that coming in, or no, but I'm good with that. So just again, to bring awareness to that space as well. So our last check-in, and I will bring this up. Which lifestyle change will you work on today? So blood pressure, cholesterol, blood sugar, physical activity, nutrition, weight loss, or toxins. So I'll give you a few minutes. Again, this is just something fun. Which one you want to participate in today? Every little habit, every little decision makes a big impact. So which one would you choose to work on today? So I'll go ahead and end the poll here and share the results. And absolutely, most of us said physical activity. So great point, great starting point. It's a great option. Like I said, the sun is finally coming out, so it might be nice to get outside and get some movement in there. And so absolutely, it's important to invest in yourself and take care of your own heart. I want to remind everyone that, again, this is for educational purposes only. There are individuals who are at an increased risk with high blood pressure, high cholesterol, diabetes, smoking habits, or who are overweight who have an increased risk. Again, we shared a few tips that you can incorporate in your daily life that helps lower your risk. Um, and then medications and surgical procedures address the immediate concern, but it does not address the root cause of the problem. So although they are valuable, we're trying to prevent having to utilize those into a worst case scenario. And so that's why we shared the lifestyle habits, because they can actually help prevent and reverse any of the unhealthy heart habits that we may have incorporated into our life so far. So I really hope you enjoyed today's webinar. Thank you so much for coming. I appreciate it, and be on the lookout for our webinar follow-up with some tip sheets and a recording of this webinar for those who attended prior. Thank you so much for your patience. I hope the audio is much better this time. Thank you so much. Have a great day. Take care.